The K-9 wouldn't let anyone touch the wounded Marine general. Not the surgeons, not security, not even the medics rushing to keep his heart from quitting. Ranger stood at the foot of the gurney like a wall, with teeth growling a hard 6-foot warning while the monitor numbers slid toward 0. Then a brand new nurse stepped out of the crowd and spoke a secret unit code that should never exist in a civilian hospital. The dog sat. The room went silent. And one question hit harder than the trauma itself. Who did we just hire? If you've ever watched Rules Matter More Than People, you'll feel this. Stay to the end, and you'll see how one calm voice can stop violence, expose a buried past, and save a life twice. Like the video comment where you're watching from, and let's begin. The question hung in the air after the dog sat heavy enough to change how everyone looked at the woman in navy scrubs. But at Seaside Regional, people were hired on paperwork, not on the strange gravity they carried into a room. Emily Carter had arrived the way most new nurses did, quietly, with a badge that still felt too clean and a smile that did not quite reach her eyes. 7 mornings earlier, Wilmington was damp with salt and heat, the kind that clung to skin before the sun fully cleared the river. The employee lot smelled like asphalt and ocean wind. Emily sat in her car an extra minute with both hands on the steering wheel, watching the hospital entrance through a windshield fogged by her own breath. She did not scroll a phone. She did not rehearse a pep talk. She only watched the flow of people and measured the pace of the day like someone checking a tide. Inside, the lobby was bright in a way that tried to soften what happened beyond the double doors. A volunteer at the desk offered a cheerful greeting. Emily returned it politely and kept moving. Her shoes made almost no sound on the tile. She had chosen shoes that did not squeak. She had chosen a bag that did not jingle. Even her keyring was quiet. Human Resources sat her in a small office where the air smelled like printer toner and hand sanitizer. The woman behind the desk had kind eyes and the bored efficiency of someone who had onboarded hundreds of people. Emily's file was thin. Not suspiciously thin, just uncomplicated. A nursing degree, a license in good standing, 2 years at a clinic in Ohio. No discipline, no gaps, no drama. The HR manager flipped pages and nodded. "We love people who come prepared," she said. Emily answered with a small smile. "I try." The HR manager pointed out policies, parking rules, badge access. Emily listened without fidgeting. She did not tap her foot or glance at the clock. She signed where she was told, her handwriting neat and firm, the kind that looked practiced under pressure. When the HR manager asked if she had any questions, Emily paused long enough to make it feel honest. "Where is the nearest stairwell from the emergency department?" she asked. The HR manager blinked, then laughed lightly as if it were a quirky preference. "I can show you on the map," she said. Emily nodded as if it mattered, because it did. By the time she reached the emergency department, the day had already found its rhythm. A child cried behind a curtain. A monitor chirped in a steady cadence. A gurney rolled past, carrying a man who kept apologizing for bleeding on the sheet. The smell was familiar in the way all hospitals were familiar. Alcohol wipes, antiseptic stale coffee, and something metallic that no air freshener could erase. Charge nurse Linda Park met her at the nurses' station. Linda had the posture of someone who had stood through too many bad nights to be impressed by anyone's first day. Her hair was pulled tight, her pen clipped to her collar, her eyes always moving. "You're Carter," Linda said. "Yes, ma'am." Linda's mouth twitched. Not a smile, not a frown. "Call me Linda. If you call me ma'am, I'll assume you're about to quit." Emily gave a quick nod. "Linda." Linda handed her a stack of papers and an access badge. "Follow me. We're short today, so your orientation is going to be real life." Emily did not react. No widening eyes, no nervous laughs. "Understood." Linda glanced at her, then turned and kept walking, testing her pace. Emily matched it without effort. The emergency department was a maze of curtained rooms, sharp corners, and half-heard conversations. Linda introduced her to people quickly. A respiratory therapist named Marco, who moved like he was always late, even when he was early. A paramedic who called everyone boss, no matter their rank. A tech who could start an IV on a moving target. Emily returned each greeting with the right amount of warmth, not too much, not too little. Linda pointed out supply closets, narcotic locks, the trauma bay door. "This is where it gets loud," Linda said, and her tone was simple, almost reverent. Emily looked into the trauma bay and took in every detail with one slow sweep of her eyes. The crash cart, the suction, the airway drawer, the wall oxygen, the cords, the way the bed could be swung to open space on either side. She did not stare. She absorbed. Linda watched her for a second. "You've worked ER before," she asked. "I've floated," Emily said. Linda made a sound. That meant she did not believe it and did not have time to argue. "Fine. You're with me. You shadow, you ask questions, you do what I tell you." Emily met her gaze. "Yes." The first patient was a fisherman with a deep laceration to the hand. He had wrapped it in a towel that was now soaked through. He tried to joke as he bled. "Guess I should have listened to my wife," he said. Linda asked questions. Emily took vitals, and the man watched Emily's hands the way nervous patients always watched hands. Her touch was steady, not hurried, not hesitant. She cleaned the wound with the calm of someone who had done it 1,000 times. When the man flinched, Emily adjusted her pressure without being told. When Linda asked for gauze, Emily already had it open. Linda's eyes flicked to her. "How'd you know?" Emily shrugged lightly. "It's the next thing." The next room was a teenager with an asthma flare, the kind that turned panic into its own disease. The boy's mother hovered, wringing her fingers. Marco, the respiratory therapist, wheeled in a nebulizer. The boy's eyes locked on Emily. "I can't breathe," he said, and he meant it. Emily crouched to his level so he did not have to look up. "You're getting air," she said. "It feels tight, but you're getting air. Focus on my voice." Her tone did not soothe by sweetness. It soothed by certainty. The boy's shoulders lowered a fraction. The nebulizer mask went on. His breathing steadied. Linda watched again, saying nothing. By midday, Emily had learned the layout without needing a map. She walked the hallways like she knew where every dead end led. She asked questions that were short, specific, and useful. She did not ask the kind of questions people ask to be liked. When Linda pointed her toward the medroom, Emily went straight to the correct cabinet without hesitation. When a tech asked where the pediatric blood pressure cuffs were kept, Emily pointed before she realized she knew. In the break room, she sat alone at a corner table. She ate quickly, not rushing, just efficient. She had brought a plain sandwich and an apple. Nothing that smelled strong, nothing that invited comments. Around her, other nurses swapped stories, half complaints and half laughter. Someone talked about a toddler who had bitten a doctor. Someone else talked about a patient who had tried to leave with an IV still taped to his arm. Linda walked in, took a sip of coffee, and nodded at Emily. "You're quiet," she said. Emily swallowed, then answered. "I'm focused." Linda's gaze lingered. "Where'd you come from?" "Ohio," Emily said. Linda waited. Emily did not add details. The silence stretched, then Linda let it go. She had seen enough people in scrubs to know when to stop pressing. Emily's second day brought a car crash. A middle-aged man came in strapped to a board, smelling like gasoline and adrenaline. His wife followed, shaking her hands covered in someone else's blood. The man kept trying to sit up. "Where's my kid?" he demanded. Linda pushed him gently back. "Sir, stay still." The man fought the restraint straps. His eyes were wild with fear. Emily stepped to the side, catching his gaze. "Your kid is being checked," she said. "Right now, we need your back to stay still." The man's breathing hitched. "You promise?" Emily did not promise. She did not lie. "I'm telling you what we're doing," she said. "You can help by holding still." Something in the way she said, "help," like it was an order, made him stop resisting long enough for the team to work. Emily helped cut clothing, started an IV, spoke calmly as the man cursed and sweated and tried not to break down in front of his wife. When the man's wife began to sob, Emily guided her to a chair without fuss. She handed her a tissue, not as comfort theater, but as a tool. "Breathe," Emily said softly. "In through your nose, out through your mouth." It was simple. It worked. Later, when the man was stabilized and transferred upstairs, Linda followed Emily into the supply room and shut the door. Linda leaned against a shelf. You didn't flinch, she said. Emily paused with her hands on a box of syringes. Should I have? Linda shook her head once. People flinch. New nurses flinch. Emily set the box down carefully. I've seen blood, she said, and her voice stayed even. Linda studied her. What kind of clinic in Ohio sees this much blood? Emily met her eyes and offered the smallest smile. A busy one. Linda did not push further, but the question stayed with her hanging between them like an unsaid diagnosis. By the third day, Emily had become useful enough that nobody questioned her presence. That was how hospitals worked. Competence earned space faster than charm. Emily offered to take an extra shift when another nurse called out. She did it without sighing, without bargaining, as if her schedule belonged to someone else, and she was only borrowing it. On that overnight, the emergency department changed personalities. The daytime bustle faded into a tighter hum. The lights felt harsher. Voices dropped lower. The windows turned black, reflecting the inside back at itself. Emily walked the quiet corridors and learned a different map, one made of shadows and sound. She noticed how the automatic doors took a half-second longer to close when humidity climbed. She noticed which hallway cameras had blind spots. She noticed the way the security officer did his rounds and how often he stopped to chat, how often he did not. Not because she planned to break rules, because her mind cataloged environments the way other minds cataloged faces. At 2 a.m, a drunk man came in with a split lip and a temper. He swung at a tech missed and hit a curtain pole. He screamed about lawsuits and disrespect. The security officer stepped in with practiced patience. Emily stayed at the side, hands visible, posture, relaxed, eyes attentive. When the man's voice rose, she did not mirror it. She let it crash against her calm until it tired itself out. When he finally looked at her breathless and angry, she spoke. You're hurt, she said. We can fix that. Or you can keep bleeding and keep yelling. Either way, you're still bleeding. The man blinked as if he had not realized bleeding was a real thing. He sat down. The security officer exhaled in relief and gave her an appreciative look. Linda noticed too. You've got away, Linda said later when the drunk man was asleep and the charting was done. Emily's pen moved over paper. It's just communication, she said. Linda laughed once, short and tired. That wasn't just communication. Emily did not answer. On the 4th day, Dr. Ethan Caldwell watched Emily work for the first time. He was the kind of physician who rarely raised his voice, not because he was gentle, but because he had learned that volume was a weak form of control. He moved through the department with the calm authority of someone who knew what he could handle and what he could not. His hair was graying at the temples. His eyes had the look of a man who had watched too many families get bad news. A patient came in with chest pain. The man was sweaty pale, his hand pressed to his sternum. The wife spoke a mile a minute, listing symptoms like she could outpace fear. Caldwell asked questions, listened, ordered an EKG. Emily placed leads smoothly, her fingers quick, her face neutral. Caldwell glanced at the EKG. Possible inferior changes, he murmured. Let's move. He turned, expecting the usual scramble. Emily already had the nitro ready, had already started. The IV had already pulled the blood tubes with labels facing the right way. She handed him what he needed without waiting to be asked. Caldwell looked at her. You're Carter. Yes, doctor. You ever work cardiology? No. He lifted an eyebrow. You're either lucky or you're trained. Emily held his gaze. I pay attention. Caldwell's mouth tightened in something that could have been approval. Keep paying attention, he said, then moved on. The staff began to talk about Emily, the way staff talked about any mystery that was useful. Quiet, solid, weirdly unshakable. Someone said she walked like a soldier. Someone else said no, she just walked like she had good posture. A younger nurse tried to pull her into lunch plans. Come on, she said, smiling. We're going to a place on Front Street. Best tacos. Emily shook her head. Maybe another time. There was always another time. There was never that time. On the 5th day, a trauma code came in fast and ugly. A motorcycle rider had taken a curve wrong. The paramedics rolled him in his helmet, cracked his jeans, torn his body too still. The trauma bay filled with movement. Voices layered over each other. A resident called out vitals. Caldwell directed. Linda ran point on nursing tasks. Emily stepped in where she was placed and did not get in the way. When someone asked for suction, she had it. When Caldwell asked for more access, she had the tourniquet on before he finished the sentence. When the monitor alarmed, she did not panic, she adjusted, checked, confirmed. Blood pooled on the floor, slick on tile. A tech nearly stepped in it and slipped. Emily caught the tech's elbow without looking away from the patient. The tech steadied, startled. "How did you—" the tech began. Emily did not answer. She stayed locked on the work. After the patient was transferred, after the room was wiped down, Linda stood at the sink, washing her hands. The water ran over her knuckles, red, fading into the drain. Linda looked at Emily. "You didn't shake," Linda said quietly. Emily rinsed her own hands, the water beating on her skin. "I don't like shaking," she said. Linda dried her hands and watched Emily for a long beat. "What did you do before nursing school?" Linda asked. Emily folded a towel once, then again neatly. "I worked," she said. Linda leaned in, her voice lower. "You don't have to tell me," she said. "But you should know we notice things." Emily's eyes flicked to the door, then back. "I know," she said. Linda's expression softened just a fraction. "You're good at this," she said. "People like you either burn out or they find a way to stay." Emily's throat moved as she swallowed. Her voice stayed controlled. "I'm not trying to be anything," she said. "I'm trying to be useful." It was the closest thing to honesty she had offered. On day 6, a patient came in from the nearby base, a young Marine with a dislocated shoulder from training. He was embarrassed, trying to downplay pain, trying to be tough in front of civilians. When Emily walked in, she clocked the haircut, the bearing, the way he sat with his back straight, even while sweating. She did not say anything about it. She treated him like any patient. She explained the process, asked for consent, checked neurovascular status with clean precision. The Marine relaxed, not because she was kind, but because she was competent and did not stare at him like he was a story. As she wrapped the shoulder after reduction, the Marine glanced at her badge. "Carter," he read. "You from around here?" Emily met his eyes. "No." He nodded as if that was enough. His gaze dropped to her hands. "You're good," he said. Emily taped down the last edge. "Hold still," she said, and the Marine did. When he left, Linda watched Emily from the station. Linda had seen that small exchange, had seen something shift. Not in Emily, but in the room. The Marine had felt understood without being told he was understood. Linda did not comment. She simply filed it away with everything else she was noticing. Day 7 started like any other. Wilmington woke under a low, gray sky, the air thick with rain that had not yet fallen. Emily arrived early again. She parked in the same spot. She walked in the same door. She nodded at the same volunteer, who now greeted her with familiarity. "Morning," the volunteer said. "Morning," Emily replied. In the locker room, she changed with efficient movements, smoothing her scrubs, checking her pockets. She made sure her scissors were clipped the way she liked them. She checked her pen light. She adjusted her badge until it lay flat and did not swing. Linda assigned her rooms with quick instructions. "You've got 3, 4, and 5, Linda said. "And if EMS calls in a trauma, you're with me." Emily nodded. "Yes." Caldwell passed by, coffee in hand, chart already open. "Morning, Carter," he said. "Morning, doctor?" He looked at her a second longer than usual, then kept walking. The day rolled forward. A child with a fever. An elderly man who had fallen and insisted he was fine while his daughter insisted he was not. A woman with abdominal pain who tried to smile through it until the labs came back ugly. Emily moved between rooms like a quiet current, carrying supplies, carrying information, carrying calm. At the end of the afternoon, the day shift began to thin. Night staff arrived with tired eyes and fresh coffee. The department's edges sharpened again. The outside world turned dark at the windows. The automatic doors slid open and shut, each time, letting in a breath of wet air. Linda came to Emily at the station. "You good for overnight?" Linda asked. Emily's face was neutral. "Yes." Linda studied her. "You ever get tired?" Linda asked, half joking, half serious. Emily's eyes lifted. "Of course," she said. Linda waited. Emily added, "Quieter, I just keep moving." Linda nodded, as if she understood that kind of tired. The night settled into its early hours, the steady hum that came before anything could change it. The monitors beeped in distant rooms. The intercom crackled with routine calls. The floor wax smelled faintly sweet under the harsher chemical notes. Outside, rain finally began to tap the glass in soft bursts, then harder, then steadier, the sound like fingers drumming a warning that no one could translate. Emily stood at the nurse's station, charting her handwriting, precise, her posture straight. She paused once, not because she was distracted, but because she was listening. Not to anything specific. To the building itself. The rhythm of doors, the cadence of footsteps, the pattern of voices. Then she continued charting as if nothing had changed, as if the hospital was simply a machine doing what it always did. In the ambulance bay, lights reflected off wet pavement. The automatic doors, waited patient and indifferent, sliding open for anyone who arrived with sirens and urgency, and sliding shut again, as if the world outside could be sealed away. The automatic doors had been patient all night, sliding open for drunks and fevers and broken bones, then sealing again as if the world could be kept outside. Now they slammed wide and stayed that way, held open by force and urgency. When Emily spoke, Ranger sat. It was not a trick. It was not luck. It was obedience, immediate and absolute, as if the words had reached down into a place in him that training had welded shut. For a beat, the whole emergency bay forgot how to breathe. Then Dr. Ethan Caldwell moved. "Trauma 1, he said, voice flat with command. "Clear the hall. Blood bank, I need a massive transfusion protocol. 2 large bore lines, type and cross, get respiratory in here now." Nurse Linda Park was already pulling supplies, eyes wide, but hands steady. A resident grabbed the gurney rail and started pushing. The combat medic kept pressure on the general's abdomen, jaw clenched, hands slick with blood. Ranger did not rise until Emily placed 2 fingers near his collar, not gripping, not tugging, just a point of contact. Her touch was light enough to be invisible to anyone not watching for it. "Easy," she said, not to the room, only to him. Ranger stood smooth and controlled and followed the gurney as if the leash was made of sound. The Marines flanked the moving group in a tight wedge that split the department like a blade. Staff stepped back without being told. It was not fear, not exactly. It was recognition of a posture that belonged to people who had learned to move through danger without asking permission. A security officer started after them, hand hovering near his radio. Staff Sergeant Alvarez glanced over once, and the officer slowed. "Let them work," Alvarez said quietly. It was not a request. The corridor to Trauma 1 felt longer than it ever did on routine nights. The overhead lights were too bright. The floor was too clean for the amount of blood being carried across it. Wheels shrieked at every seam in the tile. Emily walked at Ranger's shoulder. Her gaze stayed on the dog, then the general's face, then the monitor the medic had clipped to the rail. Her breathing never changed. She did not rush. She matched the speed of the gurney like she had done it 1,000 times. A resident, young and pale, jogged alongside her, unable to keep his curiosity from spilling out. "Who are you?" he blurted. "That command? What was that?" Emily did not look at him. "Focus," she said. The resident flushed, embarrassed, and fell back. Inside Trauma 1. The room was waiting in harsh white. The bed stood centered under surgical lights. Suction canisters hung on the wall. A ventilator sat poised like a silent animal. The air smelled of antiseptic and warm plastic and the metallic note that always arrived with real bleeding. Caldwell pointed without looking. "Monitor there. Airway at the head. Get me ultrasound ready. I want it fast. I want it now." A respiratory therapist hurried in, hair tucked into a cap, hands already pulling equipment from drawers. Linda snapped gloves onto her hands with a practiced flick. The combat medic climbed with the general, keeping pressure eyes locked on his patient like he was the only thing anchoring him to the room. "Shrapnel to the shoulder and abdomen," he said. "Tourniquet not needed. He's been hypotensive for 15 minutes. He crashed twice en route." Caldwell's eyes flicked to the general's face. The skin tone was wrong, waxy, and gray lips pale. The chest rose, then paused, then rose again, each breath too shallow. "How long since injury?" Caldwell asked. 45 minutes, Alvarez answered. Blast. Convoy hit an IED on the highway. He was pulled from the vehicle. We stabilized, then we moved. Caldwell did not ask why a convoy had been on a highway in North Carolina with a retired general in it. He did not have time for narrative. Pressure's 60/30. Linda called out, voice clipped. Pulse 140, the resident added. Oxygen, 82, and dropping respiratory, said. Caldwell stepped in, hands moving, eyes hard. 2 units uncross-matched now. Start pressers if he doesn't respond. I need access. He reached for the general's arm and stopped when a low sound filled the room again. Not a growl this time. A warning breath deep in Ranger's chest. Ranger's head lifted. His eyes tracked Caldwell's hand. His posture did not lunge, but every muscle had reloaded. Emily's fingers tightened fractionally near Ranger's collar. She did not jerk him back. She did not raise her voice. Ranger, she said, quiet. Hold. The dog's gaze flicked to her. His ears tilted forward. The tension in his shoulders eased, not completely, but enough. Caldwell looked at Emily for the first time, as if truly seeing her. You stay with the dog, he said. Keep him out of my way. Emily nodded once. Yes, doctor. Alvarez watched the exchange, expression unreadable. One of the other Marines, a corporal with tired eyes, leaned toward Alvarez and murmured something Emily did not catch. Alvarez did not answer. Caldwell turned back to the patient voice, rising just enough to cut through the noise. Expose the chest. Cut the shirt. I want to see everything. Scissors flashed. Fabric tore. Tape ripped. The general's torso was mottled with bruising that did not match the visible wounds. There were angry punctures on the right side, where shrapnel had kissed skin and gone deeper. A pressure dressing sat over the abdomen, already soaking through. Caldwell pressed 2 fingers to the carotid. Threaded, he muttered. The combat medic spoke through clenched teeth. He kept trying to talk in the truck. Then he went out. Caldwell nodded once, not as sympathy, but as acknowledgement of how close they were. Fast, he said again. A tech rolled the ultrasound machine in. The monitor glowed blue at first, then brightened. Gel was squeezed onto the probe. The resident held breath, eyes wide, as if watching a magic trick would make it work. Caldwell moved the probe over the general's abdomen, scanning quickly. Black spaces shifted on the screen, indistinct to anyone not trained. Caldwell's eyes narrowed. Fluid, he said. There's fluid. Linda's head snapped up. In the belly. Likely, Caldwell answered. We're going to surgery. Call the OR. Tell them we are coming hot. A nurse at the doorway grabbed the phone and started dialing. The combat medic's shoulders sagged a fraction with relief that was not relief at all. It was only a plan, and plans felt like control. Emily stayed near the head of the bed, one hand hovering close to Ranger's collar. The dog lay down beside the gurney again, chin close to the general's hip, eyes open. He watched every movement, but he did not interfere as long as Emily remained within his line of sight. Caldwell pointed to a resident. Get labs, CBC CMP lactate. Get a second line. I want arterial blood gas. Move. The resident nodded too fast and almost tripped over an IV pole. Someone hung blood. The red line snaked into the general's arm. A nurse pushed fluids, adjusting flow. The monitor beeped with uneven insistence. Linda called out again. Pressure, 72/40. Still garbage, Caldwell said. Emily's eyes moved constantly, not darting, but scanning. The numbers, the chest, the angle of the ribs, the rise and fall of the sternum. The way the general's jaw sat slightly slack as if fighting to keep an airway open. She leaned closer, not to touch, but to listen. Breath sounds were checked. Stethoscope pressed to the chest. A resident listened right then, left, then looked uncertain. Sounds present bilaterally, he said, but his tone lacked conviction. Caldwell did not look up. Good enough, he said. We're not solving every problem in this room. We're keeping him alive until the OR. Emily did not argue. She did not interrupt. She watched. The general's hand twitched once, as if something deep inside him still fought to return. His fingers curled weakly. Ranger's ears lifted. He pressed his head closer to the general's side. Emily's voice dropped low. He's here, she said, and it was not for the team. It was for the dog. Alvarez shifted his weight. How do you know that phrase? He asked Emily, not loud, but firm. Emily kept her eyes on the monitor. Not now, she said. Alvarez's gaze sharpened. Ma'am, that phrase is not something you pick up at a dog park. Emily's jaw tightened a subtle strain. She did not look at him. Not now, she repeated, and her tone carried a kind of authority that made even a Marine hesitate, because it did not come from rank. It came from having been obeyed before. Caldwell glanced up again, caught the tension, then dismissed it with impatience. "I do not care about your secrets," he said. "I care about keeping his heart beating." The respiratory therapist adjusted oxygen, increased flow. "Sat is 78, he called. Caldwell's head snapped. "Why is it dropping?" The therapist looked at the tubing, then the patient. "He's breathing fast, shallow." Caldwell leaned over the general, watching the chest. "Bag him," Caldwell said. "Assist." The bag valve mask was brought in. A tech sealed it over the general's face. The therapist squeezed, measured, watching chest rise. The oxygen ticked upward for a second, then fell again. Caldwell frowned. "Give me that," he said, taking over. He bagged with firm hands. He watched the chest. He listened to the lungs again, right then left. He did not like what he heard, but he did not have time to interpret it slowly. He had a patient with blood in the abdomen and a pressure that refused to climb. "Ore is ready," the nurse at the phone called. Caldwell nodded sharply. "Good. Get transport." A gurney appeared at the doorway. The room shifted into movement again, people preparing to roll. Emily's eyes caught something in the general's body that did not match the plan. It was small, a micro flinch under sedation, a tension in the left side of the rib cage, when a hand brushed near the lower ribs, like the body was guarding a pain it could not speak about. The visible wounds were on the right. The guarding was on the left. Emily's gaze snapped to the monitor. Oxygen was still dropping in a pattern that did not fit only blood loss. Respiratory rate climbed. Heart rate stayed too high. Pressure refused to settle. The room's noise rose around her, but her attention narrowed the way a lens narrows, not to panic, but to clarity. Caldwell stepped toward the foot of the bed. "Move," he said. "We're going." Emily did not step in front of him. She did not block. She spoke from where she stood, voice low and controlled, like she was offering a correction, not a challenge. "Doctor," she said. Pause. Caldwell turned his head slowly, irritation already rising. "No," he said. "We do not pause. He is bleeding internally." Emily held his gaze steady. "He is," she said. "And there is something else." Caldwell's eyes sharpened. "You are new," he said, each word clipped. "You do not run my trauma bay." "I am not trying to," Emily said. The resident looked between them, confused, almost offended on Caldwell's behalf. Linda's eyes flicked to Emily, then to the monitor, then back. Caldwell pointed toward the door with his chin. "If you have anxiety, take it outside." Emily did not flinch at the insult. Her voice stayed even. "His left chest," she said. "Listen again. The way his oxygen is dropping is not only from blood loss." Caldwell's jaw tightened. "The wounds are on the right," he said. "We have a positive fast. We have an OR ready." Emily nodded as if agreeing with facts because she was. "And his left lung is failing," she said. The respiratory therapist paused, bag in his hands, eyes narrowing. What he asked before he could stop himself. Caldwell's gaze snapped to the therapist. "Keep bagging," he ordered, then looked back to Emily with impatience edged by something else. Curiosity unwilling, but present. "What makes you say that?" Caldwell asked. Emily leaned in closer, not touching the general, but close enough to see the fine details. "His chest is rising unevenly," she said. "He is guarding left lower ribs. His saturation drops with assisted breaths. It climbs for a moment, then falls. That pattern fits pressure building in the pleural space." The resident blinked. "That's a guess," he said, defensive. Emily looked at the resident for the first time, and her eyes were not cold. They were sharp. "It is not a guess," she said. Alvarez took one step closer, as if trying to hear every word. Ranger lifted his head. He watched Emily. He watched Caldwell. He did not growl. He waited. Caldwell held Emily's gaze, measuring her. He had seen 1,000 confident new nurses and 1,000 overreaches. He had also seen the ones who had saved a life, because they noticed what nobody else did. He looked at the monitor again. Oxygen, 76. Pressure barely holding. Heart rate still climbing. He made a decision that cost him pride and bought time. "Ultrasound," he said. "Bring it to the left chest." The resident stared. "Doctor, the OR is ready." Caldwell did not blink. Then the OR can wait, he said. I am not sending him upstairs to arrest on a table. He turned to Emily. You have 1 minute, he said. If you are wrong, we move now. Emily nodded once. 1 minute is enough, she said. The ultrasound machine was pulled closer. The tech repositioned the screen. Gel was squeezed again, cold and clear. Caldwell took the probe, then stopped. You do it, he said to the tech, then changed his mind and handed it to Emily instead. The room went quiet in a different way. Emily looked at him surprised for a fraction of a second. Not because she lacked skill, because the invitation meant trust. And trust was something she had not asked for. Caldwell's voice dropped so only she could hear it. Show me, he said. Emily took the probe without ceremony. Her hand was steady. She placed it against the left chest near the ribs, angling carefully. The monitor flickered. Gray and black shapes shifted. The respiratory therapist leaned closer, eyes scanning. Linda held her breath without realizing it. Alvarez watched the screen like it was a battlefield map. Emily's face did not change, but her eyes tightened with recognition. Caldwell leaned in his expression sharpening as the image resolved into something he could not ignore. The ultrasound cart hummed softly, wheels locked, screen glowing in the hard white light, while every person in that room waited for the next breath to decide what the next move had to be. The image on the screen steadied the grainy gray field, sharpening into something Caldwell could read without squinting. He leaned closer, shoulders tight, eyes narrowing as if the light itself could be forced to confess. Emily angled the probe a hair lower, then rotated her wrist with careful precision. She did not rush. She did not fumble. Her hand moved like it already knew the answer and only needed the machine to prove it. The monitor showed a boundary where motion should have been. Caldwell's jaw clenched. His eyes flicked to the general's chest, then back to the screen. He pressed his lips together, the kind of expression doctors wore when they realized the clock had been lying to them. Stop transport, he said, voice suddenly sharp. Nobody moves him. The resident froze with a sheet half lifted. Doctor, we have a positive fast. The resident protested, as if the abdomen being wrong meant nothing else could be. Caldwell did not look away from the screen. And if we ignore this, he dies before the surgeon touches him, Caldwell said. Left chest is trapped. Pressure is building. Respiratory stared at the monitor, then at the general's ribs. You're saying tension, the therapist said, and his tone changed. He was no longer polite. He was afraid in a professional way. Emily kept the probe steady. Yes, she said. Linda Park's hands paused over an IV line. The room full of noise a moment ago became quiet enough to hear the bag valve mask squeak with each assisted breath. Caldwell straightened eyes, scanning the general's face, the neck, the chest. He looked for signs he had been too busy to notice. The faint swell at the base of the neck. The uneven rise of the left side. The way the oxygen number refused to behave. How long has his sat been falling? Caldwell demanded. Since intake respiratory answered. It bumps with bagging, then drops again. Caldwell's gaze snapped to Emily. You were watching the whole time, he said. Emily met his eyes. I was watching him, she said. Caldwell's head turned toward the supply wall. Needle, he said. 14 gauge, now. A tech moved fast. Drawers clattering open. The sound of plastic packaging tearing felt too loud. Linda was already at the bedside, her hands finding antiseptic wipes and a sterile kit. She did not need to be asked twice. The resident swallowed throat bobbing. Doctor, should we wait for X-ray? He asked, and the question came out thin and young. Caldwell's eyes cut to him. You want an X-ray, Caldwell said, or you want a pulse? The resident went silent. Emily lifted the probe away and wiped gel with a quick motion, then stepped back just enough to give Caldwell space. She did not retreat. She simply moved into the role that made the room work. Close enough to help, far enough not to be in the way. Ranger's head rose. His ears were forward. His eyes tracked Caldwell's hands as if reading intention. He did not growl, but he was awake now, every sense tuned to the same frequency as the room. Emily lowered her fingers near his collar again. Hold, she said softly. Ranger's gaze flicked to her face, then returned to the general chin hovering just above the sheet. Caldwell scrubbed a patch of skin high on the left chest, hands moving quick and sure. The general's ribs were visible now, chest hollowed by blood loss and shock. His skin had that waxy tone that made nurses stop joking. The monitor beeped again, uneven and impatient. "Pressure is 68/36, Linda called. Caldwell did not answer. He palpated quickly, found the space he wanted, then took the needle. The packaging crinkled as he tore it open. The needle looked too small for what it had to do. He hesitated for half a second, not because he was afraid to act, but because he was measuring the patient's size, the angle, the depth. He needed it right on the first pass. Respiratory held the bag valve mask steady, eyes locked on Caldwell's hands. Alvarez stood near the doorway, posture rigid, jaw clenched, as if he could will the room into obeying. Emily watched Caldwell's face more than his hands. She watched the micro-movements that signaled doubt. There was none. Only focus. Caldwell inserted the needle. A sharp hiss broke the air, immediate and unmistakable. It sounded like a tire losing its last breath. Respiratory let out a small, involuntary noise. Linda's shoulders dropped just a fraction, like her body had been waiting for proof that the threat was real. The general's chest rose again, then rose more evenly. The oxygen number climbed, 76, 79, 83. Caldwell kept his hand steady, eyes flicking between the patient and the monitor, reading the response the way he read an EKG. The pulse on the screen smoothed still fast, but no longer frantic. "Better," Respiratory said, and his voice held the kind of relief that was earned, not performed. Caldwell did not relax. "That is a temporizing move," he said. "We need a chest tube. Now." The resident blinked. "Here," Caldwell said. "In this room." "Chest tube tray," Linda snapped, already moving. "Sterile gloves, prep kit. I need suction set up." A nurse sprinted to the supply closet. A tech adjusted the suction canister, clicking it on. The low hum filled the room, steady and ready. Caldwell took a breath through his nose, then turned to Emily again, and his eyes held something different now. Not suspicion, not gratitude. Recognition of skill, meeting skill. "How did you see it?" he asked, not as an accusation, but as a demand for understanding. Emily's voice stayed controlled. "He guarded left side," she said, and the SAT behavior did not match, only hemorrhage. Pressure on the pleura can hide under shock. Caldwell looked back at the general's chest. "Good catch," he said, and it was the closest thing to praise he had in his tone. Emily did not respond. Her attention went to Ranger. The dog had lifted his head higher. He watched the needle, the blood, the movement. He did not get up, but he was no longer resting. He was working. Emily kept one hand near his collar, her presence a quiet anchor. Linda returned with the tray, snapped it open with a practiced motion. Instruments gleamed under the lights. The chest tube itself looked like a length of clear purpose. Caldwell washed and gloved quickly, the routine of sterile technique now operating at speed. He marked the site on the general's left side, just under the arm, where ribs formed a ladder. "Local," Linda said. "He's not feeling this," the resident said reflexively, eyes on the general's slack face. Caldwell glanced at the resident. "He is alive," Caldwell said. "Give local." Linda injected lidocaine even in crisis, even when the patient could not protest. Caldwell made an incision small and decisive. Blood welled. He spread tissue with clamps, pushing through layers that resisted. The sound in the room changed. It became the wet, intimate sound of trauma work. Metal against flesh, suction pulling respiratory bagging in steady rhythm. Caldwell's fingers probed, finding the space. He advanced the tube. Resistance gave way in a sudden release. Air and fluid moved through the tube, rushing out with purpose. Suction caught it and carried it into the canister with a sharp gurgle. The general's oxygen climbed again. 88, 91. His heart rate came down by degrees, still high but no longer screaming. Linda's voice cut through, steady. "Pressure is 82/48. Caldwell exhaled once short. "Better," he said again, and this time he allowed the word to land. The resident's face had gone pale, but his eyes were wide with learning, the kind that did not come from textbooks. He looked at Emily as if seeing her for the first time. "You were right," he said, and it sounded less like praise and more like shock. Emily did not look at him. She watched the general's chest, now watching for symmetry, for ease. "Now he can survive the trip upstairs," Caldwell said. The abdomen still mattered. The bleed still mattered. But the chest had been the silent blade at the ribs. If they had rolled him out and put him under anesthesia, he would have slipped away in the gap between breaths. Caldwell stepped back, stripping his gloves, his hands red, his eyes hard. "Call the OR again," he said. "Tell them we are coming, chest secured, trauma surgery needs to be ready for abdominal bleed." A nurse picked up the phone and spoke fast, voice-controlled. Linda wiped her forehead with the back of her wrist, then immediately replaced her gloves. She never stopped moving. Ranger's head lowered again, but not into sleep, into watch. Emily crouched slightly close enough for the dog to feel her, not close enough to crowd. "Good," she whispered. Ranger's eyes flicked to her face. His ears softened. He stayed. Caldwell turned toward Alvarez. "Who is the decision-maker here?" he asked, and the question was pointed. Not medical. Human. Alvarez's posture did not change. He, as Alvarez said, nodding once toward the general. "And until he wakes up, Ranger stands post." Caldwell glanced at Ranger, then at Emily's hand near the collar. "And apparently she is the only one he listens to," Caldwell said. Alvarez watched Emily. "She spoke our code," he said. "That does not happen by accident." Emily's jaw tightened a fraction. She kept her eyes on the general. "Keep him alive," she said quietly. "Ask questions after." Alvarez did not answer, but he did not push either. He had watched the oxygen climb. He had watched the color return just enough to be real. He had watched a doctor move from skepticism to action without losing control of the room. The gurney rolled in closer. The team began transferring the general to a transport bed careful around the chest tube. The process required hands. Ranger's eyes tracked every motion. A tech reached for the sheet near the general's hip. Ranger's lip lifted a silent warning. Emily's fingers touched the collar firmer now. "Hold," she said. Ranger's mouth closed. His eyes stayed sharp, but he did not move. The transfer finished. The transport monitor beeped. The chest tube line was secured to avoid pulling. Bags were hung. Blood continued to run. Caldwell stepped to the head of the bed. "Intubate," he said. "He is not maintaining." Respiratory nodded, already prepping. The room turned again, shifting gears. Medications drawn. Laryngoscope ready. A tube poised. Emily watched the airway work with a gaze that stayed calm, but her eyes narrowed when Caldwell positioned the head. "Jaw relaxer is on board," anesthesia called. Caldwell inserted the scope, found the cords, guided the tube. Respiratory confirmed placement. Breath sounds checked again. Both sides present left now stronger. The ventilator took over with controlled breaths, a mechanical steadiness that steadied the room. Oxygen climbed to 96. Linda spoke again. "Pressure is 90/55. Caldwell nodded, satisfied enough to move. "Go," he said. The transport team started rolling. Emily walked with them, her hand still near Ranger's collar. The dog rose and followed without resistance, moving like a shadow beside the bed, eyes on the general, as if the whole hospital could turn hostile in a heartbeat. In the hallway, staff paused and watched. People moved out of the way instinctively. A few faces held fear. Others held curiosity. Most held that quiet, helpless respect people felt when they realized their normal night had collided with someone else's war. The elevator opened with a chime that felt too cheerful. They rolled in. The cramped space tightened the air. Caldwell stood at the head. Linda at the side. Respiratory managing the bag and tube. Emily in the corner with Ranger. Alvarez and the other Marines flanked the door, blocking anyone from stepping too close. A security officer appeared at the end of the hall, moving faster, now radio up. "Trauma," the officer started, but Alvarez raised a hand without turning. "Not now," Alvarez said. The elevator doors slid shut, sealing in the smell of antiseptic and blood and wet fur. Inside, the monitor beeped. The general's numbers held fragile but real. The ventilator breathed for him with steady certainty. Emily stared at the monitor, then at the general's face. The gray tone had shifted. Not to health, not even close, but to survival. Ranger sat on the elevator floor body, leaning slightly toward the bed. His eyes did not blink much. Linda looked at Emily, voice low, as if speaking too loud might break the fragile truce. "You're not shaking," Linda said. Emily kept her gaze forward. "I told you," she said. "I don't like shaking." Linda swallowed, then asked the question that had been building all week, now sharpened by the last 10 minutes. "Where did you learn to do this?" Linda asked, and her tone held no gossip, only need. Emily's eyes flicked to Linda for a second, then away. "On the job," she said. Linda's mouth tightened, but she did not press. Not in an elevator, with a general bleeding behind them and Marines watching every breath. The doors opened on the surgical floor. Staff rushed forward, faces serious, hands ready. A surgeon in blue stepped in. "Report," the surgeon demanded. Caldwell spoke fast. "Blast injury, abdominal bleed. Positive. Fast, left tension, pneumothorax, relieved. Chest tube, placed intubated, transfusing pressure, improving but unstable." The surgeon's eyes widened just a fraction at the words "left tension, pneumothorax." He looked at Caldwell with a sharp respect. "Nice catch," the surgeon said. Caldwell's eyes flicked to Emily, then back to the surgeon. "We caught it," Caldwell said. The team rolled the bed toward double doors marked with red letters. The Marines moved with them. Ranger moved too until a nurse stepped forward, hands raised. "Animals cannot enter sterile OR," the nurse said automatically, as if policy could stop muscle and loyalty. Ranger's head snapped, his body tensed. Emily stepped closer, voice low, and for the first time, her calm showed strain. "Ranger," she said, "stay." The dog looked from Emily to the general, then back again, torn between instinct and obedience. Alvarez stepped in, voice tight. "He stays with the general." The nurse's eyes widened. "Sir, it is policy." Caldwell turned his patience thin now. "He is not a pet," Caldwell said. "He is the only reason we could treat the patient at all." The surgeon looked between them, then made a quick decision that belonged to surgeons the kind who had watched patients die while people argued. "There is a holding area," the surgeon said, "outside the OR doors. He can stay there with one handler, no further." Alvarez nodded once. Emily looked down at Ranger. "You stay here," she said softly. "Watch." Ranger's ears flattened for a second, then lifted. He lay down just outside the doors, chin on paws, eyes fixed on the bed as it disappeared into sterile light. Emily stayed with him, one hand resting on his vest, feeling the steady warmth of his body and the tremor of contained aggression that never fully went away. Behind the doors, the OR swallowed sound. The hum of machines became muffled. The hallway's fluorescent lights felt harsher, without the urgency of movement to soften them. Alvarez stood a few steps away, arms at his sides, posture rigid. The other Marines took positions like it was instinct, forming a quiet perimeter. Linda Park stepped out of the OR prep area to catch her breath, pulling off one glove, then the other. Her hands were red and damp. She looked at Emily and Ranger, then back at Alvarez. "Security is going to have questions," Linda said, voice tight. Alvarez's eyes stayed on the doors. "Let them," he replied. Caldwell stepped out a moment later, scrubbing his hands again, water running. He looked exhausted, in a way only adrenaline could create. He dried his hands and turned toward Emily. "You saved time," he said, voice low. "You saved him." Emily did not answer. She kept her hand on Ranger's vest, feeling the dog's breathing steady and present. Caldwell watched her for a long beat, then spoke again, quieter. "That command," he said. "It worked like you owned it." Emily's eyes lifted to meet his. For the first time in the night, there was something raw in her gaze, quickly hidden, but not fast enough to be missed. "I did what I had to do," she said. Caldwell nodded once, accepting it as the only answer he was going to get. A door down the hall opened and closed. Footsteps approached. Not hurried civilian footsteps. Deliberate ones, measured and official. The security chief, Mark Hensley, came into view, with 2 officers behind him. His face was set in the tight, practiced expression of a man who managed risk for a living. His eyes landed on Ranger first, then on the Marines, then on Emily. He stopped at a careful distance, the way people stopped when they understood a situation could bite. "What is going on?" Hensley asked, voice controlled. "Why is there a tactical dog in my surgical corridor?" Alvarez stepped forward half a pace. "Because a general is alive right now," Alvarez said, "and he would not be without that dog and that nurse." Hensley's gaze sharpened. "That nurse," he repeated, and his eyes slid to Emily's badge. Emily Carter. Emily did not move. Her hand stayed on Ranger's vest. Ranger's eyes remained on the OR doors, body still. Hensley looked at Caldwell. Doctor, he said, I need an explanation. Caldwell's voice stayed steady. Your explanation is on the monitor, in there, Caldwell said. We treated a critical patient under extraordinary circumstances. We are not done. Hensley's mouth tightened. He was not satisfied. But he was not foolish enough to pick a fight with a surgeon's clock and a Marine perimeter. His eyes returned to Emily. And I need a word with her, Hensley said. Emily's jaw tightened slightly. She did not look away. When the patient is stable, Caldwell said, cutting in before Emily could speak. Not before. Hensley held Caldwell's gaze for a beat, then nodded once, stiffly. Fine, he said, when he is stable. He stepped back, but his eyes stayed on Emily as he moved away, already building questions in his head like paperwork. Emily listened to his retreating footsteps until they faded into the hospital's ambient hum. Ranger did not move. He watched the doors with a patience that felt almost human. Emily stayed beside him, hand on his vest, eyes forward, body still, while behind the sterile doors, a team fought a different battle with blood and clamps and time. The surgical corridor held its breath. Behind the closed doors, machines hummed and alarms chirped in short, controlled bursts that never quite broke into panic. Every so often, a muffled voice rose, then dropped again, swallowed by sterile walls. The hospital's usual soundscape felt distant here, as if the building itself had narrowed to one hallway and one patient. Emily stayed on the floor beside Ranger. The dog lay with his front paws crossed, chin-low eyes fixed on the seam where the operating room doors met the frame. He did not sleep. He watched with the stillness of something trained to wait through hours of nothing or a single second of everything. Marines held their positions with the same discipline. Alvarez stood near the corner, angled so he could see down both directions of the hall. Another Marine leaned against the wall, arms folded, gaze steady. They spoke rarely. When they did, it was in fragments quiet enough to vanish under the ventilation system. Mark Hensley remained a few steps back, his radio clipped at his shoulder, his posture carefully neutral. He looked like a man who wanted order more than he wanted conflict and had learned that sometimes you got neither. Dr. Caldwell moved in and out of the scrub sink area, hands red from repeated washing, eyes fixed forward. Linda Park stood nearby with a chart in her hand that she was not reading. She watched the operating room doors, the way family members watched intensive care monitors, without blinking, as if attention could keep a person alive. A nurse in surgical scrubs stepped out and spoke to Caldwell in a low voice. Caldwell nodded once. The nurse disappeared again. Minutes passed. The air felt thicker. Then the operating room doors opened. A surgeon in blue emerged with a face set in professional restraint. His mask hung loose at his neck. His eyes found Caldwell first. We have control for the moment, the surgeon said. Significant intra-abdominal bleeding. We packed, we clamped, we stabilized. He's alive. Caldwell's shoulders loosened by a fraction. The kind of relief that still hurt. ICU, Caldwell said immediately. Already arranged, the surgeon replied. We need to keep him warm, keep the pressure up, keep the chest tube functioning. He is not out of danger. Alvarez stepped closer, his voice tight. Can we see him? The surgeon looked at the Marines, then at Ranger, then back to Caldwell, as if asking who was in charge of a hallway that no longer belonged to the hospital alone. Caldwell answered before the surgeon could. In the ICU, yes, Caldwell said. Not in the recovery bay. Not while anesthesia is working him. Alvarez nodded once, accepting the boundary because it was practical, not because it was policy. Ranger lifted his head the moment the doors moved. His ears came forward. His body tensed as if preparing to stand. Then he paused, looking at Emily. Emily placed her hand lightly on his vest. Easy, she said. Ranger exhaled through his nose and stayed down, but his eyes followed every staff member who stepped into the corridor. He tracked hands' shoes movement. His world was reduced to one target and everything that could threaten it. Hensley took a step forward. Doctor, he said to Caldwell, voice controlled. You told me I could speak to her when the patient was stable. Caldwell's gaze snapped to him, tired and sharp. He is stable enough to move, Caldwell said. That is not the same as stable. Hensley's mouth tightened. I am not trying to interfere with care, he said. I am trying to understand why a nurse can issue a command, that overrides a military working dog, and why Marines are controlling my surgical corridor. Linda's eyes flicked toward Emily. There was something in her expression that looked like worry, not judgment. Caldwell's patience thinned. Then understand this, Caldwell said. Without that nurse and that dog, he would have died in my trauma bay. You can file reports later. Hensley held Caldwell's gaze for a beat, then shifted his attention to Emily. Ms. Carter, he said, I need you to come with me. Emily rose slowly. She did not move like someone being arrested. She moved like someone stepping into a room she already expected to enter. Ranger stood with her, immediate and silent. Hensley's hand lifted reflexively, palm out. The dog stays. Ranger's eyes fixed on him. His posture was not aggressive, but it held the kind of readiness that made people step back even when they did not want to. Emily looked down at Ranger and spoke softly. Stay, she said. The dog hesitated, torn between duty and obedience. His tail did not move. His eyes cut toward the operating room doors again, then back to Emily. Emily lowered her voice further, the cadence shifting into something tighter, more absolute. Hold, she said. Ranger's body settled, not relaxed, but anchored. He sat, eyes still locked forward, muscles loaded. Alvarez watched this exchange with a hard, unreadable stare. He moved a half step closer to Emily, a silent statement that she would not be alone. Hensley turned and led them down the hall. Linda followed for a few steps, then stopped as if the hallway itself marked a line she should not cross. Caldwell watched them go, then turned back to the surgeon. Get him upstairs. Upstairs, he said now. The corridor split into two realities. One, where a team fought to keep a general alive. Another, where questions had to be answered because institutions could not tolerate mysteries. The administrative office at the end of the hall was small and quiet. The kind of room designed to feel neutral and instead felt like pressure. A table, 4 chairs, a file cabinet, a framed poster about safety compliance that nobody read. Hensley gestured toward a chair. Sit, he said. Emily sat without being told twice. Her posture was straight, her hands folded in her lap, fingers still. She did not fidget. She did not look around. She waited. Alvarez remained standing behind her right shoulder. Another Marine took the corner near the door, not blocking it, but making it clear who controlled the exit if things turned ugly. Hensley sat across from Emily and placed a thin folder on the table. He did not open it yet. Emily Carter, he said evenly. You have been employed here for 7 days. Yes, Emily replied. Your file lists a nursing degree and prior clinic work. Hensley continued. No mention of military service. Emily did not blink. I did not lie on my application, she said. Hensley's eyes narrowed. No, he agreed. You just did not include certain things. He opened the folder and slid 1 page forward as if paper could trap a truth. You spoke a phrase that immediately subdued a military working dog, Hensley said. Our doctors could not approach the patient until you did that. Explain it. Emily held his gaze. It was a command, she said. Hensley's mouth twitched with irritation. I know it was a command, he said. I want to know why you knew it. Alvarez spoke for the first time since entering. That phrase is unit-specific, he said. Voice clipped. Not general military. Not something you hear in movies. Hensley's eyes flicked to Alvarez. And you are Hensley began. Staff Sergeant Miguel Alvarez said. United States Marine Corps, attached to that general. Hensley nodded once, as if he had guessed as much from the boots alone. Alvarez's gaze returned to Emily. That dog has stood down for 3 people, Alvarez said. His handler, his trainer, his commanding officer. You are none of those. Emily remained still. Hensley leaned forward. So he said, Who are you? Emily's jaw tightened almost imperceptibly. She looked down at her folded hands for a moment, then back up. I am a nurse, she said. Alvarez's eyes hardened, and before that, he pressed. Hensley's tone stayed clinical, but the frustration sharpened. You identified a life-threatening chest injury pattern quickly, he said. You also influenced a major treatment decision in the trauma bay. I need to know if you have training you did not disclose. Emily took a slow breath. I did not perform a procedure, she said. Dr. Caldwell did. Hensley's fingers tapped once on the folder. That is not the question, he replied. The question is your background. Emily held the silence for a beat, letting it stretch the way Alvarez had stretched silence in the trauma bay, the way Marines stretched silence when they wanted someone to fill it with a mistake. Then she spoke. "I served," she said. Alvarez's posture tightened. Hensley's eyes sharpened. "Where?" Hensley asked. Emily's voice stayed even. "Navy," she said. "Hospital corpsman." Assigned with Marines, the room went still. Not dramatic stillness. Operational stillness, the kind that meant everyone was recalibrating. Alvarez's expression changed, subtle and fast. Recognition, then respect, then the cold focus of verification. "What years?" Alvarez asked. Emily's eyes did not waver. 4 years active," she said. 2 deployments. Hensley flipped a page. "Why was it not listed?" he asked. Emily answered without heat. "Because I did not want to be hired for that," she said. "I wanted to be hired as a nurse." Hensley's mouth tightened. "This is a hospital," he said. "Transparency matters." Emily's gaze did not drop. "I disclosed what was required to do my job safely," she replied. Alvarez leaned in slightly. "That command," he said. "You did not just know the words. You knew the tone. You knew the cadence." Emily's eyes flicked toward the door for a fraction of a second, then back. "You train around working dogs long enough," she said, "you learn how to speak to them." Alvarez did not accept that. "Which unit?" he asked. Emily's voice stayed calm. "I am not discussing unit details in a civilian office," she said. Hensley's eyes widened slightly. "You do not get to refuse," he said, irritation now visible. Alvarez's tone remained controlled. "She can refuse," he said. "And she should." Hensley turned toward him. "This is my facility," Hensley said. Alvarez met his gaze. "And that is my general," Alvarez replied. "He is alive because of her. You can have your paperwork, but you are not going to treat her like a suspect." Hensley inhaled slowly through his nose, the way people did when choosing restraint. He looked back at Emily. "I will need to involve human resources," he said. "I will need to verify your credentials and your service." Emily nodded once. "Verify," she said. Hensley's eyes lingered. "And I will need a statement about why you withheld information." Emily's expression did not change. "I did not withhold licensure," she said. "I did not withhold competence." Hensley closed the folder with a soft thud. "We are done for now," he said. "Do not leave the building." Emily stood. Alvarez moved with her, a silent escort. The Marine by the door opened it without being asked. In the hallway, the air felt colder. They walked back toward the ICU past staff, who glanced up and then looked away quickly, as if eye contact might pull them into a situation they did not understand. Emily's shoes made barely any sound. Alvarez's boots did. Linda Park waited near the elevator, arms crossed, exhaustion etched into her face. "You okay?" she asked Emily quietly. Emily's gaze stayed forward. "I am fine," she said. Linda watched Alvarez. "They grilling her," Linda said, not as a question. Alvarez's face did not move. "They are asking questions," he replied. Linda's jaw tightened. "She saved his life," Linda said. Alvarez's eyes flicked toward her. "So did you?" he said. And for a moment, his tone softened into something like respect. The ICU smelled different from the emergency department. Less sweat, more plastic, more quiet. The lights were dimmer, softened by curtains and monitors. The sounds were smaller, but more constant, like the building had changed from chaos to vigilance. General Harkins lay in a bed surrounded by machines that hummed and blinked. The breathing tube was gone. A nasal cannula sat under his nose. His skin was still pale, but color had returned enough to make his face look human again. Bandages covered his abdomen. A chest tube line ran down and away, secured and taped. Ranger lay at the foot of the bed on a blanket a nurse had brought because some people did not need a policy to tell them what was right. The dog's eyes were half-lidded, but the moment Emily stepped into the room, his head lifted and his tail thumped once against the blanket. It was a small sound in a quiet room, and it felt like a verdict. Harkins turned his head slowly. His eyes were sharp, despite the fatigue. The kind of eyes that had watched too many briefings, too many deployments, too many maps with red marks. He looked at Emily as if he was cataloging her before she even spoke. Ranger's tail thumped again. Harkins let out a rough breath that might have been a laugh. "He likes you," Harkins said, voice raspy. Emily stopped near the doorway, posture respectful. Sir, she began. Harkins lifted a hand weakly. Do not, he said. Call me Jack. I am technically retired. Emily held still. Yes, sir, she said anyway, and it came out before she could stop it. Harkins' mouth tugged faintly. Stubborn, he murmured. Then his eyes sharpened again. They told me what happened in the trauma bay. Emily's gaze dipped for a fraction, then returned to his face. I did my job, she said. Harkins watched her closely. That phrase you used, he said. I heard it through the haze. Felt like a hand on a shoulder. Emily did not answer. Harkins continued, voice low. Alvarez said you were a corpsman, he said. Emily's jaw tightened slightly. I served, she replied. Harkins nodded once, as if confirming a theory. I have seen a lot of calm people, he said. Most of them are calm because they have never been afraid. The ones who have been afraid learn to hide it better. Emily's eyes did not flicker. Harkins' gaze shifted to Ranger, then back. That dog does not trust strangers, Harkins said. He trusts a small circle. His handler is still recovering. His trainer is in another state. And his commanding officer is me. Yet he listened to you. Emily's hands stayed at her sides, fingers relaxed, but still. You were hurt, she said. He was protecting you. Harkins nodded. And you, he said. You were protecting him. Emily did not move. Harkins's eyes narrowed slightly, searching. Where did you serve? He asked. Emily hesitated for the first time. A pause that lasted only a breath. Afghanistan, she said. Harkins' gaze sharpened. Where he pressed. Emily's voice remained controlled. Helmand, she said. Later, Kandahar. Harkins stared at her. Something in his face shifted. Not surprise. Recognition. He swallowed, throat working around pain. Field hospital, he said slowly. Near Sangin. Emily's eyes tightened a small crack in her composure. Harkins continued. I was there. In 2019, he said. Not stationed. Passing through. Inspecting forward bases. I remember the med tent. I remember the smell. I remember how the corpsmen looked at us like we were ghosts until we bled. Emily's throat moved as she swallowed. Harkins' voice softened. I sent people to that tent, he said. Some of them came back because of people like you. Emily's eyes held on his for a moment, then dipped toward the floor. I did what was needed, she said. Harkins watched her. And now you are here, he said. In a civilian hospital in Wilmington. Why? Emily lifted her gaze again, and her voice carried a quiet firmness. I am not pretending, she said. I am a nurse. Harkins nodded slowly. I believe you, he said. I also believe you are trying to keep your past from becoming the only thing people see. Emily did not answer. Ranger shifted his body slightly and pressed his head against the mattress, a grounding motion that looked almost gentle. Harkins watched that too. They are going to make this complicated, Harkins said quietly. Emily's jaw tightened. They already did, she said. Harkins' eyes narrowed. Who, he asked. Emily did not say Hensley's name. She did not have to. People who manage risk, she said. Harkins exhaled slowly. I have met those people, he said. They measure consequences with spreadsheets. Emily's gaze stayed steady. They are not wrong to ask questions, she said. But they are wrong to make it about fear. Harkins held her gaze for a long beat. Alvarez will protect you, he said. But you should not have to be protected for doing the right thing in a trauma bay. Emily's eyes flicked a flash of something like pain. I did not want attention, she said. Harkins nodded. I know, he replied. But attention finds certain things. Emily did not respond. Her face was controlled again, mask reinforced. A nurse entered the room to check vitals, eyes moving quickly and respectfully. She glanced at Ranger, then at Emily, then at the Marines near the door. Visiting time is limited, the nurse said softly. Harkins nodded, then looked back to Emily. Thank you, he said. It was not dramatic. It was direct. It held weight without ornament. Emily gave a small nod. Yes, sir, she said again, and this time Harkins did not correct her. As Emily stepped out, Ranger's eyes followed her until she was in the hallway, then returned to Harkins. The dog did not whine. He did not move. He simply stayed the way he had always stayed. Outside the ICU, Hensley waited near the nurse's station, with a woman in business casual and a badge that read, Human Resources. The woman's hair was pinned back tight, her smile polite and brittle. Ms. Carter, the HR representative, said, "I am Dana Whitaker. We need to speak." Emily stopped. Alvarez stepped in closer, his presence immediate. Dana's eyes flicked to Alvarez, then back to Emily. "This will not take long," Dana said. Emily's voice remained calm. "Then ask," she said. Dana opened a folder. "Your application does not indicate prior military employment," she said. "This is not necessarily disqualifying. But we need clarity." Emily nodded. "My license is valid," she said. "My degree is valid." Dana's smile tightened. "This is about disclosure," she said, "and scope of practice." Caldwell appeared from the ICU doorway, his scrubs wrinkled, his face tired. Scope. Caldwell repeated, voice flat. "She did not place a chest tube." "I did." Hensley's eyes narrowed at Caldwell. "She influenced a major clinical decision," Hensley said. Caldwell's gaze hardened. "She spoke up," Caldwell replied. "That is what competent staff do." Dana's eyes shifted between them, measuring tension like a thermometer. "We will need statements," Dana said. "We will need documentation. We will need to review." Linda Park stepped up beside Caldwell. "Review what?" Linda asked, her instincts. Dana's smile did not change. "We are required to review any deviation from protocol," Dana said. Caldwell's voice dropped lower, more dangerous. "Protocol would have killed him," Caldwell said. Hensley stiffened. "We are done discussing this here," Dana said quickly, her tone attempting authority. "Ms. Carter, you are being placed on administrative leave pending review. Effective immediately." The words landed in the air like a slap that did not leave a mark, but still hurt. Emily's face did not change. Alvarez's posture tightened. Linda inhaled sharply. Caldwell stared at Dana. "Are you serious?" he asked. Dana held her ground. "It is a standard process," she said. "This is not a punishment. It is a pause." Caldwell's eyes narrowed. "A pause," he repeated. "On the nurse who kept a general alive in my trauma bay." Dana's voice remained smooth. "This is risk management," she said. "We must protect the hospital." Linda's mouth tightened. "From what?" Linda asked. "From competence." Hensley interjected, voice controlled. "From liability," he said. Alvarez's eyes cut to him. "She did not act recklessly," Alvarez said. "She did not grandstand. She did her job." Dana looked at Alvarez, then back to Emily. "You will receive paperwork," Dana said. "You are not terminated. You will be contacted with next steps." Emily nodded once. "Fine," she said. Caldwell's expression tightened with anger. "Do not do this," he said, voice sharp. "You are going to lose her." Dana's smile flickered. "That is not your decision," she replied. Emily turned slightly as if ending the conversation with her movement instead of her words. Linda stepped closer to Emily, voice lower. "You do not have to leave," Linda said. "We will fight this." Emily's eyes softened for a fraction. "I do not want to fight," she said. Linda's gaze hardened. "Then you picked the wrong building to save someone in," Linda replied. Emily did not smile. She simply nodded once, accepting the reality she had tried to avoid. Alvarez walked with her toward the exit, not escorting her out like security, walking beside her like someone who understood what it meant to be judged for silence. In the staff lot, the rain had stopped, leaving the asphalt slick and reflective. Emergency vehicles sat like quiet beasts under the lights. Emily's car was still where she had parked it that morning. She stopped with her hand on the door handle. Alvarez stood a step away. "This is not over," he said quietly. Emily looked at him. "It does not have to be over," she replied. "It can just be done." Alvarez's jaw tightened. "You saved a general," he said. "You saved Ranger's mission. You saved time. You saved blood. You do not get to be treated like a problem." Emily's eyes held on his steady. "Being useful does not prevent consequences," she said. Alvarez stared at her for a long beat, then nodded once. "I will report your service to my chain," he said. "I will verify what needs verifying." Emily nodded. "Verify," she said again, and opened her car door. Inside her apartment, the quiet felt sharper than the hallway quiet. There were no monitors, no voices, no purposeful movement. Only the hum of the refrigerator, the distant rush of traffic, the faint creak of the building settling. Emily set her keys on the counter in the exact same place she always set them. She washed her hands even though they were already clean. She dried them with a towel folded twice, neat. Her phone vibrated on the counter. A message from Linda. Do not quit. The phone vibrated again. Another message. Different number. Heard what you did. Thank you. Emily stared at the screen without opening it. Her thumb hovered, then pulled back. She sat at her small kitchen table and placed both hands flat on the surface as if grounding herself. Her breathing was slow, controlled. The calm that had saved lives now had nothing to do. Outside the window, Wilmington lights shimmered on wet streets. The next morning at Seaside Regional, the emergency department ran as if nothing had happened because hospitals could not pause for anyone's drama. Patients arrived. Alarms sounded. Staff moved. But the story moved too. It started with whispers at shift change. Did you hear? One nurse said, voice low. They put her on leave, another replied, and the words sounded wrong even as they were spoken. Dr. Caldwell heard it in the corridor outside Trauma 1, the same corridor where he had watched a general's oxygen climb, because a new nurse refused to stay quiet. He stopped walking, just stopped. Linda Park caught up to him, her eyes tired and furious. They served her papers, Linda said. Caldwell's face hardened. She saved his life, he said. Linda nodded once. And they called it a pause, she replied. Caldwell turned toward the break room with purpose. Get whoever is on shift, he said. Tell them to come in for 5 minutes. Linda moved fast. Nurses drifted in. A tech. 2 residents. A respiratory therapist still wearing the same shoes from the night shift. People held coffee they did not drink. Exhaustion sat on every face, but anger sharpened it. Caldwell stood at the center of the room, hands on the back of a chair. This is wrong, he said. A resident spoke first, voice uncertain. They said it is about liability. Caldwell's eyes snapped to him. You know what liability is, Caldwell asked. It is letting your staff be punished for speaking up when a patient is dying. Linda leaned against the counter. She did not even do the procedure, Linda said. She called it. Caldwell did it. Respiratory nodded. She caught it, the therapist added. We were moving to OR. We would have lost him. A tech spoke quietly. She caught a medication error on her 3rd day, the tech said. Saved us from a reportable incident. Another nurse nodded. She stayed late last week when we were short, she said. Did not complain. Did not ask for favors. A second nurse added. She worked like she had something to prove, she said, and her voice softened. But she did not act like she wanted praise. The room filled with small confirmations, the kind that sounded ordinary alone and became undeniable together. Caldwell looked around at them. I am writing a letter to the board, he said. A formal letter, not an emotional one, a clinical one. If they want risk management, I will give them risk management. Linda's hand lifted. I will sign it, she said. Hands followed, one after another. Nurses, residents, techs, respiratory. People who rarely agreed on where to put the coffee pot now agreed on one thing. Caldwell pulled a notepad from his pocket and began writing with clipped precision. He wrote about the timeline, about the inability to access the patient, about the immediate change when Emily spoke, about the clinical finding of tension physiology confirmed with bedside imaging, about the intervention that prevented cardiac arrest, about the fact that Dr. Caldwell performed the procedure, about the fact that Emily provided critical assessment under physician supervision, about the culture of safety that depended on staff speaking up without fear. He wrote in language the board could not shrug off. Linda watched his pen move and felt something in her chest tighten. She had seen administrators ignore anger. She had seen them ignore tears. She had seen them ignore gratitude. But she had also seen them fear a paper trail. When Caldwell finished, he tore the page out and set it on the table. Sign, he said. They did. By the end of the hour, the letter had more names than Caldwell expected. People who had not worked that shift came in just to add theirs. People who had only spoken to Emily twice still signed because they had seen what competence looked like and recognized it in the way she moved. A younger nurse who had not slept since the night before pulled out her phone and typed a message into the internal staff channel. She did not name Emily. She did not name the general. She wrote a sentence that carried heat anyway. A hospital punished a nurse for saving a life. She hit send. The message spread through departments. ICU, radiology, surgery. People read it between patients and felt something tighten behind their ribs. Calls started. Not from outside yet. From inside. A surgeon called Caldwell. I heard the surgeon said. Send me the letter. I will add my name. A radiology tech called Linda. Is it true? The tech asked. They put her on leave. Linda's voice was flat. It is true, she said. More names were added. Then someone outside the hospital heard. It was not a calculated leak. It was a tired person with a full heart and a phone in their hand. A brief post. No names, no details. Just enough to suggest a wrong that felt recognizable to anyone who had ever watched a system protect itself. The post was shared by a local veterans group within hours. They did not know the full story. They did not need it. They recognized the shapes of it. Comments flooded in, some angry, some grateful, some suspicious, all loud. By midday, the front desk phone at Seaside Regional rang so often it became background noise. The receptionist's voice grew hoarse. Seaside Regional, how can I help you? Pause. I cannot comment on personnel matters. Pause. Yes, we support veterans. Pause. No, I cannot confirm any details. Hensley stood near the front office with his arms crossed, listening to the chaos he had tried to prevent. His radio crackled with updates. A reporter had called. Then another. Administrator Evelyn Brooks sat in her office with the blinds half closed, staring at policy binders that suddenly looked like liabilities themselves. Her computer screen glowed with emails. Subject lines stacked like incoming fire. Urgent. Media inquiry. Board request. Community complaint. Donor concern. Brooks picked up her phone and dialed legal counsel again. The voice on speaker was calm, almost bored. It is escalating, Brooks said, trying to keep her tone controlled. It was always going to, counsel replied. Public perception does not care about nuance. Brooks pressed her fingers to her temple. She saved him, Brooks said. This is not about the clinical outcome, counsel answered. It is about process. Brooks stared at Emily's thin file on her desk. A folder that suddenly felt heavier than any chart. Is it illegal? Brooks asked for her to not disclose prior military service. No counsel replied. But it complicates things. It raises questions. It creates vulnerability. Brooks exhaled slowly, and placing her on leave, she asked, that protects us. It creates distance, counsel said. It signals review. Brooks's voice tightened. Review looks like punishment, she said. Counsel did not pause. Then manage the message, counsel replied. Brooks ended the call and sat in the quiet hum of her office. She listened to the hospital moving behind her walls. A gurney rolling, a nurse calling a doctor, a code announcement overhead. Life continued. That was the problem. Institutions survived because life continued. Her assistant knocked and stepped in, holding a clipboard like a shield. The emergency department is upset, the assistant said. Brooks did not look up. They can be upset, she said. The letter has 47 signatures, the assistant continued. Brooks' eyes lifted, then sharp. 47, she repeated. The assistant nodded. And there are calls from veteran organizations, the assistant added. They are asking for a statement. Reporters are asking for a statement. Someone posted online that we punished a hero. Brooks leaned back slowly. Her chair creaked. We did not punish her, Brooks said. The assistant's eyes held on hers, careful. It reads like we did, she said. Brooks stared at the file again. 7 days of perfect performance. No complaints. No conflict. No stories. Almost nothing personal. The kind of employee administrators loved because they left no mess. And yet, she had created the largest mess Brooks had dealt with all year by doing something right at the wrong angle. Brooks stood and walked to the window, looking down at the parking lot. People moved in and out under the sun. Cars pulled in. Ambulances idled. She thought about the phrase she had used with counsel. Distance. A pause. The words felt clean. The reality did not. Schedule a board session, Brooks said finally. The assistant blinked. Today, Brooks added. The assistant hesitated. The general is still in the ICU, the assistant said. Brooks' mouth tightened. Then we should move quickly, she replied. In her apartment, Emily sat at her kitchen table with a mug of coffee she had not tasted. The window light shifted slowly across the floor. Her phone buzzed again and again. She did not answer unknown numbers. Then Linda's name appeared. Emily picked up on the second ring. "Linda," she said. Linda's voice came through sharp with exhaustion. "The whole department is behind you," Linda said. Emily closed her eyes briefly. "I did not ask for that," she replied. "I know," Linda said. "But you earned it." Emily's throat tightened. "I wanted to work," she said. "Just work." Linda exhaled hard. "They do not let people like you just work," Linda said. "Not when you show them what they missed." Emily's fingers tightened around the mug. "I do not want to fight," she said again. Linda's voice softened slightly. "Then do not fight," she said. "Just do not disappear." Emily stared at the wall across from her. Plain paint, no photos, no decorations that told a story. "Why are they doing this?" Emily asked quietly. Linda did not hesitate. "Because they are scared," she said. "They hear military and they think unpredictability. They hear confidence and they think lawsuit. They would rather be safe on paper than right in a trauma bay." Emily's jaw tightened. "I did not do anything outside the doctor's hands," she said. "You spoke up," Linda replied. "That is enough to threaten the wrong kind of person." Emily's phone buzzed with another incoming call while Linda was still speaking. Emily ignored it. Linda continued. "They called a board session," she said. "Brooks is trying to contain this." Emily's gaze remained steady. "I do not have anything to contain," she said. Linda's voice hardened again. "They do," she replied, "and they are going to make it your fault if nobody pushes back." Emily looked down at her hands on the mug. The same hands that had held the ultrasound probe steady. The same hands that had not shaken when air hissed out of a chest. "I do not want to be a headline," she said. Linda's voice dropped quiet and fierce. "Then show up," she said. "Do not give them an easy story." Emily breathed slowly. "I was hired to be invisible," she said. Linda answered without softness. "No," she said. "You were hired to do the job. You did it." Emily did not respond. The silence stretched. On the other end, Linda's breathing was audible, tired, but steady. "Are you coming in?" Linda asked. Emily's eyes lifted to the window. "I am on leave," she said. Linda's tone turned sharper. "Leave is not a cage," she said. "You can walk into that building and stand there. You can be present. You can let them see your face while they say your name." Emily's throat moved as she swallowed. "I do not want to scare anyone," she said. Linda's voice softened again just a fraction. "You did not scare us," Linda replied. "You saved us from watching someone die." Emily closed her eyes for a second. When she opened them, her gaze was clear. "I will come," she said. Linda exhaled. "Good," she said. "And bring nothing but yourself. They will try to pull you into details. Do not let them turn you into a spectacle." Emily's voice stayed calm. "I know how to sit in a room and stay quiet," she said. Linda made a sound that could have been a laugh if it had not been so tired. "Yes," Linda said, "you do." Emily ended the call and set the phone down carefully. She stood and walked to the sink. She ran water over her hands and dried them with the same folded towel. It was a small ritual, a way to put order into a day that had none. Across town, Seaside Regional's boardroom, lights turned on in the middle of the day, casting a sterile glow over polished wood and empty chairs. Evelyn Brooks laid folders at each seat with the kind of precision that looked like control. Mark Hensley stood near the door with his arms crossed, jaw set. Dana Whitaker from Human Resources arranged pens as if signatures could fix what had already moved beyond paper. In the ICU, General Harkins slept in shallow cycles, his chest rising more evenly now, ventilator replaced by the slow draw of his own lungs. Ranger remained at the foot of the bed, eyes open. In the emergency department, Dr. Caldwell walked past Trauma 1, without looking inside. His expression tight. His mind still hearing the hiss of trapped air and the sound of a dog sitting down to a voice that did not belong in a civilian hospital. And, in a quiet apartment, Emily Carter put on clean scrubs, clipped her badge to her collar, and stepped out into a Wilmington afternoon that suddenly felt less like a fresh start and more like a test of whether she could stand where everyone could see her. Emily did not arrive like a protest. She arrived like a shift. The hospital lobby smelled of floor cleaner and wet umbrellas. Afternoon light fell through the glass doors and turned the polished tile into a pale mirror. People moved around her with that familiar hospital urgency, heads down, hands full, eyes tired. Nobody stopped her at the desk. Her badge still opened the employee corridor. The institution that had placed her on leave had not yet decided whether to treat her like a mistake or an asset, so the building did what buildings did. It let her pass. Linda Park met her near the staff elevator. "You look like you slept," Linda said, and it was not an accusation. It was relief. Emily kept her voice even. "I closed my eyes," she said. Linda's mouth tightened a half smile that did not have room to live. "Good," Linda replied. "Come on." They walked together down the hall past ICU signage and quiet rooms where families sat in plastic chairs with folded hands. The boardroom was on the administrative wing, a place most clinical staff only visited when something had gone wrong enough to require paperwork. The carpet was thicker there. The air felt cooler. The walls held framed photos of donor dinners and ribbon cuttings. Outside the boardroom door, Dr. Caldwell stood with his arms folded, the crease between his brows deeper than usual. A handful of staff were nearby, not a crowd, just enough people to show that Emily was not alone. Respiratory Marco leaned against the wall, eyes hollow, from too many hours awake. One of the residents shifted his weight nervously, as if he wanted to say something and could not find the right words. Caldwell saw Emily and straightened. "Ms. Carter," he said. Emily stopped in front of him. "Doctor," she replied. Caldwell held her gaze for a beat. "I wrote what happened," he said. "Exactly. No drama, no embellishment." Emily nodded once. "Thank you," she said. Caldwell's jaw tightened. "You should not have to say thank you," he replied. Linda touched Emily's elbow lightly, then let go. "They are in there," Linda said, voice low. "Brooks Hensley, Dana board members. Legal is on speaker." Emily's face stayed calm. "Okay," she said. The boardroom door opened. Dana Whitaker stepped out first. Her posture practiced her expression polite, in a way that felt rehearsed. "Ms. Carter," Dana said. "They are ready for you." Caldwell's voice cut in controlled. "She is not here as a defendant," he said. Dana held her smile. "Doctor, this is a personnel review," she replied. Caldwell's eyes did not soften. "It is also about patient care," he said. "Do not pretend it is not." Dana's smile flickered, then returned. "Ms. Carter," she said again. Emily stepped forward. Linda's voice came quietly at her shoulder. "Stand tall," Linda said. Emily did not answer. She walked into the room. The boardroom was larger than it needed to be. Polished table, high-backed chairs, a wall-mounted screen displaying a sterile agenda, a pitcher of water that nobody had touched. The people seated around the table looked like people who rarely saw blood unless it was on a spreadsheet. Administrator Evelyn Brooks sat at the head. Her hair was immaculate. Her hands were folded. Her eyes were alert in a way that made the room feel like a test. Mark Hensley sat to her right, shoulders squared, expression set. Dana sat to her left with a folder open and a pen ready. 3 board members faced Emily, each wearing a different version of concern. One older man with a veteran pin on his lapel. A woman with sharp eyes and a legal posture. A younger man whose hands never stopped moving near his notebook. A speakerphone sat in the center of the table. Legal counsel was on the line, a voice without a face. Brooks gestured toward a chair at the far end. "Ms. Carter," Brooks said. "Please sit." Emily sat back, straight, hands resting lightly on her thighs. She did not cross her arms. She did not fidget. She looked at Brooks and waited. Brooks did not waste time. "We are conducting an administrative review related to the events last night," Brooks said. "We appreciate that you contributed to a positive clinical outcome." Emily's expression did not change. Brooks continued. "We also have concerns regarding scope of practice disclosure and institutional risk." Emily kept her gaze steady. "I understand," she said. Hensley leaned forward slightly. "You issued a command that controlled a military working dog," he said. "Our staff could not access the patient until that moment. That created safety concerns." Emily's voice stayed calm. "It created safety," she said. Hensley's jaw tightened. "You also challenged Dr. Caldwell's initial treatment plan," he added. In a high-acuity setting, Emily did not look away. I gave him an observation, she said. He assessed. He decided. Caldwell's letter sat on the table near Dana's folder. Emily recognized his handwriting on the first page. The sight of it felt strange, like seeing her own pulse on a monitor. Brooks tapped her pen once, a small sound that carried in the quiet. Ms. Carter Brooks said your employment file does not include military service. That omission matters. Emily answered evenly. I listed my education and licensure, she said. My clinical experience, everything required for the role. The younger board member spoke, his voice cautious. Why omit it? He asked. If it was honorable service, why not include it? Emily held his gaze. Because I wanted to be evaluated as a nurse, she said. The woman board member leaned in, eyes sharp. Transparency is a standard expectation in healthcare, she said. We need to know who we are hiring. Emily nodded once, acknowledging the statement without yielding. You knew my license, Emily said. You knew my degree. You verified my references. The older board member with the veteran pin spoke, voice quieter than the others. I served, he said. Sometimes you do not lead with it because people treat it like a story before they treat it like a skill. Brooks glanced at him, then returned to Emily. This is not about sentiment, Brooks said. This is about policy. The speakerphone clicked and the voice of legal counsel filled the room. From a liability perspective, counsel said the concern is whether Ms. Carter influenced a decision outside her scope. If her assessment had been incorrect and the patient deteriorated, the hospital would be exposed. Emily looked toward the speakerphone, then back to Brooks. I was correct, she said. Counsel did not react to the certainty. This time counsel replied. Brooks turned slightly as if aligning herself with the word time. That is why you were placed on administrative leave, Brooks said. Not as punishment, as process. Emily's voice did not rise. It felt like punishment to the staff, she said. Hensley's eyes narrowed. The staff does not manage legal exposure, he said. Emily met his gaze. The staff manages dying people, she replied. A beat of silence landed hard. Brooks exhaled slowly, then reached for a folder. Let us address the clinical portion, Brooks said. Dr. Caldwell states you identified signs of tension physiology and recommended bedside imaging. Emily nodded once. Yes, she said. And you have training that explains that recognition, Brooks continued. Training not disclosed. Emily kept her face still. I have experience, she said. Brooks's expression tightened. Where Brooks asked. Emily paused only long enough to choose her words. I served with Marines, she said. I worked trauma in deployed settings. Hensley leaned back slightly as if the confirmation strengthened his position. So you withheld relevant information, he said. Emily did not take the bait. I did not withhold my capability, she replied. I used it to keep a patient alive. The woman board member spoke again, voice cool. Ms. Carter, she said, did you speak a unit-specific command in a civilian emergency department? Emily answered without hesitation. Yes, she said. Is that command classified? The woman asked. Emily's eyes stayed steady. I am not discussing unit details, she said. Not here. Hensley's mouth tightened. This is exactly the problem, he said. You are asking the institution to trust you while refusing disclosure. Emily turned her head slightly toward him. I am asking the institution to understand what happened, she said. I did not bring secrecy into this hospital. It came in on a gurney with a dying man and a working dog that would not let anyone near him. Brooks's posture remained composed, but her eyes sharpened. Ms. Carter, she said, we are trying to determine whether you can continue employment here. Emily nodded once as if accepting the stakes. Understood, she said. Brooks opened her mouth to continue. The boardroom door opened. Conversation stopped in a single collective inhale. Lieutenant General Jack Harkins stepped into the room. He moved slower than a healthy man, a cane in his right hand, his left shoulder still stiff with pain. His dress uniform was crisp ribbons arranged with precise care. The sight of him in that room shifted the air the way rank shifted air, even when a person claimed retirement. At his side walked Ranger. The dog's vest looked cleaner than last night, but his eyes were the same. Alert, measuring, uninterested in anyone's comfort. A board member rose instinctively, then sat again, unsure of the protocol for a man who did not ask permission. Brooks stood quickly. General, she said, You should be resting. Harkin's voice was raspy, but steady. I was resting, he said. Then someone mentioned my name in a meeting I was not invited to. He looked around the table. His gaze was slow and direct, landing on each person as if taking attendance. I am the patient at the center of this, he said. So I am here. Brooks's composure tightened. This is a personnel matter, she began. Harkins lifted his hand slightly, not dramatic, just enough to stop the sentence. It is also a patient safety matter, he replied. And I am qualified to speak on both. Ranger sat at Harkins's heel without being told, posture, erect eyes scanning the room. A faint tap of his tail hit the carpet once and stopped. Emily remained seated back straight. Her expression did not change, but her eyes flicked to Ranger for a fraction and returned to Harkins. Harkins glanced at Emily and gave a small nod, almost imperceptible. Then he turned to Brooks. I am told Nurse Carter was placed on leave, he said. Brooks held her ground. General, we are required to review deviation from protocol, she said. This is not personal. Harkin's mouth tightened slightly. Protocol would have killed me, he said. The room went still again. The younger board member cleared his throat. General, he said, we are not questioning the outcome. We are questioning process. Harkins nodded once, as if acknowledging a familiar argument. I have spent 30 years watching people worship process, he said. It makes them feel safe. It also gets people killed when the situation changes and nobody can adapt. The woman board member leaned forward. General, she said, the hospital must consider liability. Harkins looked at her, expression flat. I will sign whatever waiver you want, he said. You can have my signature in ink and in blood if it calms you down. Brooks's eyes widened slightly. That is not how liability works, she said. Harkin's gaze stayed steady. I know how it works, he replied. I also know how communities work. If you punish the person who kept me alive, your message to every veteran in this region will be clear. Hensley spoke, voice controlled but defensive. We are not punishing, he said. We are reviewing. She did not disclose relevant background. Harkins turned toward Hensley. Why should she have to? He asked. Hensley blinked. It matters, he said. Harkins's voice stayed even. Does your hiring process require every applicant to list every job they have ever had? He asked. Or only the ones that make you nervous? Hensley did not answer. Harkins looked around the table again. I have been in rooms where a single person spoke up and saved everyone, he said. I have also been in rooms where nobody spoke up because they were afraid of how it would look. His gaze settled on Brooks. You have a nurse who recognized a hidden life threat, he said. She spoke up. Your physician listened. I am breathing because of that chain of competence. Brooks's jaw tightened. We also had an armed standoff in our emergency department, she said. Marines, a tactical dog security reaching for weapons. That is unacceptable. Harkins nodded slowly. It was unacceptable, he agreed. And Nurse Carter prevented it from becoming worse. Ranger's ears shifted at the sound of her name, then settled again. Harkins continued. When I was bleeding out, your staff could not get within reach, he said. Nurse Carter did. She did not raise her voice. She did not provoke the dog. She used the correct command, the correct tone, and the correct calm. That is competence, not a liability. The older board member with the veteran pin leaned forward, voice quiet. I think the general is right, he said. We are focusing on fear, not function. Brooks's eyes flicked to him, then back to Harkins. We have to protect the hospital, Brooks said. Harkins's voice softened slightly, but it did not lose its edge. Protect it from what he asked. From the kind of nurse you say you want. Silence. Brooks glanced down at the folders on the table, then up again, as if choosing her next words carefully. General, she said you are in no condition to be here. Harkin's eyes did not shift. I am in the condition to decide who gets my respect, he replied. And who gets my attention. He looked at Emily. Nurse Carter, he said, stand up. Emily rose smoothly. Harkins watched her, his expression serious. You did not ask for my endorsement, he said. You did not ask for a spotlight. But you will not be treated like a problem in the same building that depended on you to keep me alive. Brooks's lips parted slightly, then closed. The room felt smaller, not because of Harkins's uniform, but because his presence forced decisions. He turned to the board. If you remove her, he said, I will speak publicly about it. Not as retaliation, as truth. The younger board member shifted uncomfortably. Brooks looked down at her notes, then at Dana, then back to Emily. The speakerphone clicked again. From a legal standpoint, counsel said carefully the general's waiver would not eliminate all institutional exposure, but it would mitigate certain claims. Harkins gave a small nod as if that was expected. Brooks inhaled slowly. General, she said, we are not interested in public conflict. Harkins' eyes stayed steady. Then choose accountability over optics, he replied. Brooks sat back down. Her composure remained, but something in her face changed. The calculations shifted from control to survival, not of a patient, but of an institution trying not to lose its credibility. She looked at Emily. Ms. Carter Brooks said we want to make an offer. Dana's pen moved poised. Emily's expression did not change. I am listening, she said. Brooks chose her words carefully. We want you to remain employed here, Brooks said. Not only as an emergency nurse. We propose creating a Veterans Care Liaison role, a program that bridges military-specific medical needs with civilian care, training our staff on combat-related patterns and improving intake for service members and veterans. The room held still again, but this time it was not fear. It was the weight of a door opening. Emily looked at Brooks, then briefly at Caldwell, who had entered quietly and stood near the wall. Caldwell's face was unreadable, but his eyes held steady support. Emily returned her gaze to Brooks. You are offering me a position based on the thing you questioned, Emily said. Brooks did not flinch. We are offering a position based on what you demonstrated, she replied. Emily's voice stayed calm. Can I ask a question, she said. Brooks nodded. Emily kept her posture straight. If I had told you in my interview that I served with Marines, that I worked deployed trauma, Emily asked, would you have hired me? The room went quiet in a sharper way. Dana's eyes dropped to her folder, then lifted again. Hensley's jaw tightened. Brooks held Emily's gaze for a long beat. I do not know, Brooks said finally. Emily nodded once, as if the answer confirmed something she had already carried. Then I am glad you met the nurse first, Emily said. Harkins watched her expression, unreadable. Brooks leaned forward slightly. This program would be public, Brooks said. It would be part of our relationship with the community. Emily's face stayed calm, but her eyes tightened. I did not come here to be a public symbol, Emily said. Brooks's voice remained even. We are not asking for symbolism, she said. We are asking for structure. Emily held the silence for a beat, then spoke again. I will accept, she said. Dana's pen moved slightly, then stopped as if waiting for the rest. Emily continued. On one condition, she said. Brooks' eyes narrowed. What condition? Brooks asked. Emily's voice did not rise. This is not a poster, she said. It is training protocols and support. Real support. For veterans who come in carrying things they do not explain. For staff who see things they cannot unsee. If this becomes a public gesture, without substance, I will not do it. Brooks held Emily's gaze. The room waited. Then Brooks nodded once, slow and deliberate. Agreed, she said. Harkins exhaled through his nose, a quiet release. Ranger remained still, at his heel, watching Emily, the way he had watched her in the emergency bay, as if recognizing the same steadiness in a different kind of fight. Brooks looked to Dana. Draft the role, Brooks said. Effective immediately. Ms. Carter returns to work under this program structure with clear clinical pathways and defined responsibilities. Dana nodded, already writing. Hensley's eyes remained hard, but he did not object. Not with Harkins in the room, not with Caldwell's letter on the table and signatures behind it. Brooks turned to Emily. You will meet with me and Dr. Caldwell tomorrow, Brooks said. We will establish training priorities. Emily nodded once. Yes, she said. Brooks looked at Harkins. General, she said, we appreciate your presence. Harkins's voice stayed steady. Do not thank me, he replied. Do the work. He turned slightly, one hand resting on his cane. Ranger, he said. The dog rose smoothly and stood close. Harkins looked at Emily once more. Good work, he said quietly. Emily met his gaze. Rest, she replied. Harkins's mouth tugged at the corner, then he turned and walked out, Ranger at his side, nails clicking softly against the carpet. After the door closed, the room released a collective breath. Caldwell stepped forward, eyes on Brooks. That was the right call, he said. Brooks's expression was controlled, but there was a faint strain around her eyes. It was the necessary call, she replied. Emily remained standing until Brooks dismissed her with a nod. She left the room without ceremony, Linda waiting in the hallway. Linda saw her face and did not ask for details. She simply nodded once, and her shoulders lowered like she had been holding tension since last night. Caldwell came out behind her. He looked at Emily. "You did well in there," he said. Emily's voice stayed calm. "I did not speak much," she replied. Caldwell's eyes narrowed slightly, then softened. "That is why you did well," he said. 3 months later, Seaside Regional still looked like a hospital. The same fluorescent lights, the same hum of machines, the same smell of antiseptic that never quite left the walls. But there were small differences if you paid attention. In a training room off the emergency department, a group of nurses and residents sat in folding chairs, coffee cups in their hands, eyes fixed on the front. A whiteboard held diagrams of chest anatomy and common blast patterns. No slogans, no banners, just information. Emily stood at the front, in scrub sleeves rolled up to her forearms. She held a marker, but did not draw for show. She spoke plainly. "Some injuries hide behind the obvious," she said. "You will see the bleeding and miss the pressure. You will see the wound and miss the physiology." A resident raised a hand. "How do you notice it early?" he asked. Emily looked at him steady. "You watch the patient more than the monitor," she said. "You listen again when something does not fit. You do not let the plan become a blindfold." The room was quiet, not tense, attentive. Questions followed, practical and sharp. Emily answered without drama, translating experience into steps people could use at 2 in the morning when fear made hands clumsy. Later that night, she worked the floor. The emergency department was busy in the familiar way. A toddler with croup, a man with a fishing hook in his thumb, a woman with chest pain who insisted it was heartburn until the EKG disagreed. Emily moved through rooms with the same calm she had carried on her first day, but she no longer moved unseen. People called her by name. They asked her to look at monitors. They listened when she spoke, not because she demanded it, but because she had earned it. Linda Park caught her at the nurse's station and slid a chart toward her. "Room 6, Linda said. "Veteran. Not talking much, wife says he is fine." "He is not fine." Emily nodded once. In room 6, a man sat on the edge of the bed, with his hands clasped tightly, knuckles white. His eyes tracked the door before Emily entered, then flicked to her badge and paused. A small pin near her name caught his gaze. Something in his shoulders dropped a release so small most people would miss it. Emily did not mention the pin. She did not mention service. She simply introduced herself. "I am Emily," she said. "I am going to check you out." The man nodded once, jaw tight. Emily took vitals, asked questions, kept her voice steady. When he hesitated, she did not fill the silence with chatter. She let him choose his words. Down the hall, a familiar set of footsteps sounded heavier than hospital shoes. Staff glanced up. Conversations paused. General Harkins walked slowly through the corridor in civilian clothes, now cane-still present posture, still unmistakable. Ranger walked at his side wearing a different vest, lighter, with a patch that read, "Therapy Dog," in clean block letters. Ranger's eyes remained alert, but his body carried less tension. He paused at a doorway where a child sat with a stuffed animal, waiting for imaging, eyes wide with fear that had nothing to do with war and everything to do with being small in a place that smelled like needles. Ranger sat beside the chair without being told. The child stared at him, then slowly reached out a hand. Ranger did not move. He allowed the touch steady and patient. The child's breathing slowed. Emily saw the moment from the nurse's station, a quiet picture framed by hallway light. Harkins watched too, his expression unreadable, one hand resting on the cane handle. Linda stepped beside Emily. "Hard to believe that is the same dog," Linda murmured. Emily kept her eyes on Ranger. "He is doing the same job," she said, just in a different room. Harkins turned slightly and met Emily's gaze from down the hall. He gave a small nod, then continued walking Ranger, moving with him calm and present. Emily returned to room 6. The veteran patient looked up as she re-entered. "He was a working dog," the man said quietly, voice rough. Emily nodded once. "Yes," she replied. The man swallowed. "Good dog," he said. Emily adjusted the cuff on his arm. Yes, she said again, and her voice carried the same quiet certainty that had stopped a growl in an emergency bay. The monitors beeped, the doors slid open and shut. The hospital kept moving, and within that movement, small moments held their ground. A patient who felt understood without a speech. A staff member who spoke up without fear of being erased. A dog who sat beside someone trembling and did not need to explain why.